the blood sugar is 120, come to the ED with a cough, nurse, witness, and a co-worker administering the wrong medication. In the review of the leadership and management program for the intensive course. السلام عليكم ورحمة الله وأهلا وسهلا بكم في لقائنا اليوم in the review of the leadership and management program for the intensive course. هذا محدثكم عبد الكريم بلاسي. What we are going to discuss in this session, we are going to come in the very brief introduction and try to summarize the tips in the leadership management course for nursing students in the review course, deal with the question types and answer strategies regarding to the leadership and management, and we will go for some examples. In this topic, we will come to discuss the leadership theories and style, decision making and problem solving in nursing, communication and conflict resolution, nursing care delivery models, nursing staffing and workload, ethical and legal consideration in the leadership, quality improvement and patient safety, and change management. The first part in this revision will be talking about the leadership style. As we know, all the Kurt Lewin already suggest apart from in 1950s argue there are different types of the leadership style, and we are moving between these styles. The first one is regarding to the XYZ theory of the generation, and they discuss the democratic leader. And on the other hand, in the following or the next part of it, it's the democratic style. Within this theory, they argue that the leaders already differentiate between either they are job-centered or employee-centered. And there are the people already moving between them, and they call the situational leaders. And then the fourth model, or four different models of the leadership style, which are the democratic, situational, democratic, and laissez-faire leaders. Understanding these 4 leadership styles is important for us to clarify the meaning of the leadership practice. What are the practices or the 5 main practices that the leader should be able to do? And this will give us a differentiation between the leadership as a practice and management as practice. بناء عليها, we are going here to say the practices for the leadership are: number 1, model the way. In this way, the leadership already able to provide the method or the road for the subordinates or followers. Number 2 will be inspire the shared vision. In this case, the leader able to deliver this shared vision for the other staff, able to disseminate this vision, able to make it clear for them, which at the end going for all the people to understand why they are here, what they are doing, and their own roles and responsibilities. Number 3 is a challenge the process, which means that we are looking for the current practice and try to get out from the previous work, for the previous methodology of doing the tasks. Number 4, enable others to act, which give them the support, training, and also encouragement to come to the number 5 in the leadership practice, which is encourage the heart. This will take us for the management cycle or the practices for the management, which is planning, organizing, staffing, directing, and controlling. The differences between both practices reflected on the organizational level. In this case, we know that the planning, which starts by collecting the data and making the plan clear, to organize the tasks, then fill these tasks with the people, while staffing, directing them and control their own practice. And this cycle is going to the endless way that after controlling, the planning is started, then organizing, staffing, and so on. Understanding of the differences between the leadership and management and what are the tasks between them, come to know that the differences in the followers characteristic make us able to differentiate the types of leader that already originated from. In the leadership grade, also we have some overlap between the characteristic of the leadership and management practice to come to discuss about more than 81 possibilities of the leadership grade. What's important for us here are the 5 on the screen. When we come here to differentiate the leaders' styles or the name of how the practice of the leadership start, we'll come here to say that there are people focused from the leader point of view, and there are the product or task focus. And between them, the leaders already distributed as apart from the relation between the people and the leader. To come to say that the club leader or laissez-faire, which is more focused on the people, while they are away from the task oriented. On the direct downsides, whom already unable to provide in a people focus or task focus to be impoverished leader, أو القائد الضعيف. While vice versa, the leader able to interact with the followers and show that they are able to be in a people focused and task focused to be the team leader. On the other side, the authority compliance leader or autocratic leader, he was located in this directed where already he only focused on the tasks, not on the people. Between them, the majorities of the leader coming on, which is the middle of road managers. This this will take us here to know more about the organizational power and networking. In this case, we need to know more about the types of power coming on the organization. There are two types of power, and each of these had its own characteristic: positional power or legitimate power, and personal power. When we come to discuss about organizational power, we should know the two concepts: degree of power and perception of employee about presenting of this power, which means that the degree of power already different based on the organizational structure. When we are going up on the organizational structure, the degree of power increased. When we go down, the degree of power decreased. In all cases, the employee should be able to differentiate and catch that he or she, that's the leader or this person, give or take a kind of power. And from this way, we should differentiate the types of personal power. That to know the first type of the personal power is the persuade power, which is already depends on the charisma of the person, the way of communication, the ability to influence others toward this direction. The second type of the personal power is knowledge, information that the person already get or have. And remember always that the power, talking about the ability to influence others' behavior. In this case, we are able to change someone else from doing or preventing them from doing things based on the knowledge and information you have. Number three from the types of personal power is the connection power. When someone able to reach or arrive for someone with organizational power, or the group of people able to build a bargain or agreement toward the facts that they are able to do. The fourth type is the expert's power, or the power that comes with you by the experience. And when we come to the organizations, then we will be inside of the conflict resolutions and the consequences of the building of team. And we remember that the effective communication techniques that will help us to resolve the conflicts and arriving to the proper team building originated from the skills that will be developed by the staff and the leader, of course. And this effective communication strategy starts by the active listening. Active listening here means show empathy, paraphrase concerns, and confirmation for and understanding. Also, the second step will be in a clearing messaging. That means the leader will use direct, respectful, assertive communication with the team members and followers. And there will be an nonverbal clue. That means we are maintaining eye contact, open body posture, and keep the regular tone. Finally, we are talking about regular feedback, which is encouraging the open dialogue and create safe discussion for the team members. And when the conflicts already happen, it will end by one of these five. لما يصير في عندي conflict، واحدة من هذول الخمسة هم النتائج اللي راح تندرج أو تنتج عن هذا الconflict. Either first is the collaborating or win-win approach. In this case, finding mutual benefits for this conflict between the two parts, then both parties that having the conflict will find a way for mutual solution. Number two will be compromising. That the discussion or the strategy for conflict resolution are shown by the give and take. And we give a lot of examples about staff need 2 days off and end by 1 day off and 1 day coming to the duty. In this case, both parties make concession and they both reach the agreement by giving and take. So not all of them take everything, but at least they take something. Number three is accommodating or yielding, which is one party prioritized maintaining harmony over their own interest. And this is an example like what we discussed in the course about the behavior of Abida when she agreed to take the day off when she take the duty of Suhaib based on the situation that already part to come to their own part yielding. بهذا المعنى بتعني أن يتنازل أحدهم عن رغبته مقابل البقاء على الفريق. Number 4 is avoiding or dealing with a conflict. In this case, used when the issue is minor or emotional needs to cool down. Fifth is the worst for one side and making sure that the other side is taking everything, which is forcing a decision. A leader enforces a solution, often in urgent situations. Apart from these 5 conflict resolution approaches, avoiding is the most worst because it leads for additional problems in the future and did not fill at the end by solving the problem. After that we'll go for the staffing. كم عدد التمريض اللي احنا نحتاجه في وحدة ما? How many nurses do we need to satisfy or make a unit to work or a hospital or healthcare system to operate? In the definition, staffing consists of 3 main factors or dimensions, and we should be able to satisfy these dimensions. We're talking about a process of determining an appropriate number of nurses with a proper mix for the nurses to meet the needs. So we're talking about 3 main themes that should be operated or maintained to ensure that we are in the staffing level. And this will be getting some differentiation regarding to the specific unit, service, or patient population. In the staffing, there are a lot of discussions happen regarding to the methods used or applied to calculate how many nurses do we need based on the number of beds, patient acuity, and the kinds of patient acuity. Is it related to the nature of tasks or patient acuity in general as a one dimension? When we come to staffing, we should know about the nursing workload. In the class, we differentiate or clarify the meaning of the nursing workload to be apart from measurements and what we don't want to see, or the nurses don't like it, apart from the consequence of or problems related to the nursing workload, is the nursing overworkload. In this case, in this conceptual framework, we will be able to differentiate that the nursing workload will lead for higher job dissatisfaction. In this case, from moving from the nursing overworkload, we increase the patient safety harm, which is something sad, something bad, we don't like it. At the same time, the job stress will be higher, quality of care will be low, and the patient, the results will be dissatisfied because their own needs are not satisfied. In this case, the nurses will complain of job dissatisfaction. The productivity of nurses will reduce, nursing retention will be reduced, and nursing intention to stay will be less, which lead at the end for or after that to burn out, أو الانحراق الوظيفي. In this case, the burnout start the nurses to have low organizational commitment. They don't like to work in this place, which lead for the turnover. Turnover mean we need the new nurses to cover this shortage. So we increased the cost of hiring, the training cost, and of course the marketing cost, because the word of mouth for this hospital start to be bad, and that lead for nursing shortage. And at the end also we come to the nursing overworkload. And then how the nurses already distribute their own time within the care, the nursing time, which is already here calculated or estimated to be in 8 hours, start by the nursing, non-nursing activities that take 2 hours, and the nursing activities that take 6 hours, 24% of this time going for the indirect patient care, and around 5.3 to 5.5 hour going for the direct patient care. This is the nursing intensity, or what the patient take from the nursing time. And at the end, the patient will take only the nursing activities, as the non-nursing activity is non-patient related care, such as the unit management, coaching, training, attending education, maintenance. All this is apart from the non-nursing activities. Calculation of all of that mean the nursing workload, or what are the kind of tasks that the nurses will accommodate during their own duty. And this part from the staffing, how we will organize this nurses over of the units, our assignment efforts. Then we come to the nursing care delivery models, how the nurses will provide the care. Nursing care delivery model is the organization, structure, and delivery of nursing care and healthcare settings are outlined. There are, over time, the nurses change the methods that they already accommodate the number of patients, complexity, workforces levels, technology, and healthcare demands. The first methodology of how the nurses distribute the tasks over of them is the total patient care. Total patient care is a very simple methodology and clear. This model entails a single nurse attend to a patient every needs during their own shift. بمعنى آخر ممرضة أو ممرضة واحدة بيستلم المريض كامل from A to Z. It's the most traditional nursing care approach still commonly found in critical care units. In this case, the nurse will be responsible for the patient to the overall care. They will be responsible about vital signs, medication, all the other tasks. For example, in ICU nurses, through the shift, nurse is responsible for the medication, keeping eye on the vital signs and monitor, carrying out the necessary, making the reposition, doctor rounds. All the tasks that required for this patient will be covered by one nurse, and this is the total patient care. The history of this methodology started to develop since early of 1900 years, since the beginning of the 20th century, particularly when nurses carrying out for very complex individuals in a smaller hospital and fewer patients. However, there are a lot of challenges happen in this methodology, and whom already engaged in the leadership course, they know about the story of Hafsa, and at the end when she come to cry and keep crying that all these tasks she was unable to cover and to provide the proper care for the patient due to that she's only responsible about the total patient care, and no one will looking for what's going on with her. All the nurses are busy with their own patients. With the complexity of the healthcare system, the second methodology of the nursing care delivery method, which is called the functional nursing. The provision of care is broken. Then we take the tasks over for the patients and discuss with it as tasks. Then we define the roles such as administering medication or changing the dressing or making the bedding, bathing, whatever, giving for different nurses. For every patient, nurses are support personal care carrying out individual responsibilities. في الفانكشنال نيرسينج النيرسز في هذا الحالة بيقسموا التاسكس عليهم، فصار في عندي nurse responsible for administration of medication, changing the dressing, documentation, rounds, and so on. And the nurse will be responsible for administering medication, will administer the medication for all patients in the unit at that shift. This is called the functional level. So, for example, one nurse will be responsible for drug administration. She will not do anything in that shift rather than drug administration or medication administration. And the other one will be doing bathing for all patients and so on. So the patient in this case will be exposed for all nurses and will receive one task from each nurse or group of nurses. The reason for developing the functional nursing due to the nurses shortage during the Second War, International War, when there was a breadth of staff, the number of staff are so much less, efficacy was required to care for a high number of patients. As no single nurse is in charge of the patient's entire care, it leads to fragmented care. Apart from the negative consequence of the functional nursing is that the patient exposed for a lot of nurses. And this lead for the fragmented care. Who responsible for what? There is no particular nurse responsible to say that there is no overlap or taking care of the patient as apart from the main priorities. All the nurses will focus to finish these tasks, specific tasks. So if the patient complains of pain and he ring the pill, then the nurse responsible for a drug camp, for example, then she will refer him to another one, and another nurse will refer him to another one. And the responsibilities here will getting missed. And if then a problem happen or incidents happen, the responsibilities and accountabilities getting defragmented. And this at the end lead for the patient dissatisfaction, low level of patient satisfaction associated with the functional nursing. That lead to another modification happen on the system and make it under the team nursing, which is number 3 in the nursing care delivery models. A group of healthcare professions collaborate to provide care for a patient group, typically under direction of registered nurse. Then we have a team of nurses, usually it consists from registered nurses and licensed practical nurses. So they are working together to provide a care for a group of patients. And usually this team had responsibilities. For example, 6 to 10 patients are under the care of the team lead by RN, which registered nurse, which also include licensed practical nurse and nursing assistants. Based on the group or the characteristic of the group in this situation, we are talking about each team will be responsible for different skills, experimenters, and the registered nurse or team leader will be able to give directions for the nurses what to do and how to do, and following up all the care for these 6 to 10 patients. Important here in team nursing to differentiate it that the team leader in this example is not the charge. There's something different, and they are only responsible about this 6 to 10 patients and their own team to provide the required care for them. However, there are also some weaknesses developed by the team nurses regarding also the patient care and responsibilities and the nursing satisfaction. And still the care defragmented. And from the patient point of view, still he or she exposed for a different type of nurses. And also the tasks getting defragmented between different people. Then the number 4 from the methods of care is the primary nurse. Primary nurse or primary nursing means that the organization assures that the patient will be assigned by one nurse during all hospital journey. So the patient from the ED will be responsible or taken care by one nurse, and this nurse will flow up from one part to another. To understand the primary nursing, just think about a patient and their family and the same nurse already part from his or her family. This is how we can understand the primary nursing. When one part from the family come to the ED and the daughter or son apart from the nursing team, so the family will be in contact with this patient and following up and coordinate and dealing up with all other kinds of specialties. So this is the primary nursing. And in this case, we are talking about a nurse allocated for a patient for all the length of their hospital stay. So they will be like a nurse and companion in the same way. So this nurse will stay in the managers for all area of care, keeping in touch with the medical staff and gives the patient direct attention when they are working and keeping contact with them. Primary nursing created in 1960s and the 1970s with a goal of enhancing nurse-patient communication and offering more continuity of treatment. In this case, the patient knows that the only point of contact will be the primary nurse. So all the needs or requirements or parts of it, it's related to one nurse. However, there are a lot of weaknesses coming from the primary nursing related to the personal limitations, can make its implementation difficult, and it encourages accountability. So the best accountability way that we know exactly if the patient requirements or needs satisfied or not by asking the primary nurse. But there are a problem that the personal limitations, because we will take the nurse out from all their own life and keep only this nurse for this patient all the time, 24/7, which means that still it's difficult to be applied on a wide level. Then the last one from the nursing care delivery method is the patient-centered care. In this patient-centered care, the nurse transfers their own way from being in a nursing care to being a part from the team. في البيشنت سنترد كير صار في عندنا فريق متكامل. هذا الفريق المتكامل بياخذ البيشنت requirements and preferences, and the nurse part from this team. It's addition to the nurse, there will be other medical professions such as doctors, social workers, and all this team caring for the same patient. So they are coordinating with each other to convert their own needs to be satisfied. مثال عليها عندي مثلا multidisciplinary team convenes to create a care plan that incorporates the patient family in decision making, attends the patient physical, emotional, and social needs. Patient-centered care, which first appeared in 1990s and the beginning of 2000s, is a response to the modern healthcare system, increasing the focus on providing high-quality, customized, and in some references, they call it individualized care. So we come here to know exactly this patient, what they are looking for, and what we should do to satisfy that care. However, there are a lot of challenges also and weaknesses in applications. And here, when we are able to understand the differences between these five, we know that the patient-centered care, now it's costly and exhausted for the system, and it will lead for a lot of people to participate in the care. And then we will go for the handover and handling the patient or endorsement. The way of handover or endorsement, also called in some references, refer to transferring the responsibilities. أو اللي احنا بنسميها بالعربي عملية الاستلام والتسليم. Transferring responsibilities and accountabilities from patient care from one healthcare provider, and in this case the nurse, to another nurse in the following shift. For example, the nurse already finishing her or his duty at 3 p.m., but the patient's still there in the hospital. So the other nurse will come to take this responsibility and take this accountability, which allow for the nurse to go home, right, or finish the duty. This usually happens during the shift change, when the nursing finish their own shift to another nurse that taking over of the patient care. Also, it takes place when we transfer the patient from one area to another. For example, the patient was in an ED or emergency department or OPD, and now already we're going to be in a different unit, for example, in surgical ward or OR, whatever, then the endorsement or handover will happen for this patient, and this includes transferring the responsibilities from the nurse in the ED to the nurse in the surgical ward. Important for the handover to know that we are transferring a critical information. This information, important details about the patient condition, treatment plan, medication, and any changes during the shift are communicated. So all the important information and the critical information already communicated and transferred and confirmed for the receiving of this information. We are talking about ensuring the continuity of care. So we are helping prevent errors, ensuring that the patient care continues smoothly without gaps. Also, from the understanding for the definition, we know about the legal and the professional responsibilities, that all it's a part or contains legal and professional responsibilities and accountability. The outgoing nurses provides accurate and up-to-date information. So the new nurse already received the most updated information about the patient condition, what happened during the previous shift, and then we should be able to differentiate or assign or specify who is taking this responsibility. So nurse A make the endorsement to nurse B, and nurse A provide all this information, and nurse B confirm receiving of this information. There are several formats for the handover. It can be done verbally, face-to-face, beside handover, written handover or electronically by electronic health records documentation such for example نظام الشفاء الموجود عندنا في المستشفيات واللي بوضح فيه بالذات ما هي المعلومات التي ستستلمها أو تأخذها الممرضة القادمة على الشفت الجديد. The most important methodology that we will use for the endorsement الطريقة أو الفريم ورك اللي حيوضح لي عملية الاستلام systemized conceptual framework that will lead us بنسميها ISBAR breakdown or ISBAR methodology. ايش هي الإسبار؟ هي abbreviation مجموعة أحرف كل حرف بيعني دلالة على tasks معينة راح تنعمل في خلال هذا الوقت. نبدأ في أول وحدة I identification. So you should identify yourself, name, role and the unit. Who you are. Who is the nurse that are providing the care? What are the rules that happen on that time? And we are talking about the patient in which unit. Identify the patient information. And I think since the fundamental course, we are focusing on the methods to identify the patient. Name, age or year of birth, and medical record number. So we know exactly you are talking about which patient. We are not identifying the patient based on the room number or bed number. We're talking about the patient specified by the name, age, and this is important to confirm that we are talking about specific patient, and we confirm that we are talking about the correct identification for that patient. S is the situation where they state the current issues or the reason for communication. Why we are doing this one? Because I am leaving and you're coming. And for example, what happened for the patient in the current situation make him to come to the hospital, reason for the seeking care. For example, the patient has a sudden drop in the blood pressure in how many minutes and so on. So we are clarifying exactly the situation that make the patient to come to the current care or required services. Then P, we're talking about the background to provide the relevant medical history and context. Why the patient? What are the medical history for this patient? The patient was admitted with a pneumonia and has been on IV antibiotics, for example. This is a background. Then we'll go for A, assessment. Share your clinical observation and concerns. Based on the nursing assessment in your shift, what are the concerns or the details that should be transferred? The patient blood pressure, for example, now is 85/50, heart rate, the vital signs, all this part from your assessment. Breathing sounds, so physical assessment scores will coming in the assessment section. R is the recommendation. What should be done next? So just the next step or what you need. Examples, I recommend increasing the IV fluids, or maybe you can contact the doctor to discuss about the IV fluids, or we are waiting the doctor to come, so please follow up with it. So whatever the kinds of recommendation that come from one nurse to another or from one side to another, called it as a recommendation section for this care. Then when we come to the tasks, we should know about the time management and the nurse able to make or put the priorities of care based on what should be done now, what can be eliminated or postponed, and what is the best time for the nurse to prove this condition. And there are a lot of questions come in the review for the priorities and when the tasks should be done and how the tasks will be done. Now, after that, we will go for the quality section. And in this quality section, we will be able to differentiate between the quality as apart from the patient safety and evaluate the patient safety and, of course, the patient safety harm. And in this definition, we'll be able to differentiate the kinds of the patient, the component of the quality of care in nursing. By talking about the safety, so these are the component of the quality: safety, effectiveness, patient-centered care, timeline, efficiency, equity, evidence-based practice, and continuity of care. The care that we will provide should be safe. On the same time, we'll be assuring the effectiveness, and apart from the effectiveness, that the tasks for the patient are already satisfied, and the patient will be on the center of care. The patient needs already satisfied in a timeline, efficient way, and there are no differences between the patient and the others. Evidence-based practice and the updated examples, and at the end, this is continuity of care that satisfy the patient needs. The second part from the components of the quality was the international patient safety goals. This is a part mandated in all tests and exams of the nursing, the same for the practice, accreditation, and the hospitals. What are the international patient safety goals? We're talking about identifying the patient correctly. So whatever we start to do in a procedures or apart from the tasks, whatever the kind of endorsement will be given for the patient, identifying the patient correctly is the key. And this will assure that the improve effective communication between the team members. So the second international patient safety goal is improve the effective communication. Safety of high alert medications, all the kinds regarding to the dangerous looks like medication will come under this category. Then safe surgery, the pre-op care. We are assuring that when the patient will go for making a surgery on left eye, there are measures in the hospital that assure the patient receive the surgery in the correct way. And also in this kind, we'll discuss the surgical site infection and what are the methods that will prevent this from happening. Also, the hospital-acquired infections all will be the fifth international patient safety goals. We are responsible to do the hand hygiene compliance, all the measures, the medical sepsis, surgical sepsis. This is part from the HIAs or hospital healthcare associated infections. Number 6, the falling down. We know from the fundamental course, physical assessment about patients in risk for falling down, and all of that to come to the leadership course. When we come, what we will do at the hospital to prevent the falling down from happening. Within the quality, there are important terms that come within the questions or scenarios to differentiate or assign the tasks to be. Either the first one is the adverse events, and this is what we don't want to see. We don't want to see any adverse events. So what is the adverse events? Adverse event is unexpected and undesired incidents directly associated with the care and services provided to the patient. So something we don't like to see. Adverse events اللي احنا خطأنا على سبيل الحديث تاعنا نوصفها بأنها الخطأ الطبي. Incidents that occur while providing the healthcare results in the patient death or severe disability, injury or harm. هذا الخطأ الطبي اللي انعمل أدى إلى either the patient death or severe disability or injury or harm for the patient. So there are a consequence happen from this mistake. So we should have in the to name an events or incidents as adverse events. There is a problem happen. The care that should be provided did not provide in a proper way, or a different procedure or adding procedure come to the patient, and it leads for death or injury. An adverse outcome for the patient include, for example, injury, complication. A simple part of it when the patient gets infection while already in the hospital. We discussed about the scenario when the Hafsa maybe come to patient with a chest infection and go for patients with a chemotherapy. If the patient coming to the hospital for chemotherapy, getting infection inside the hospital, so the chemotherapy will not be taken, and there are differences or disabilities, injury or harm happen for this patient. Examples for the adverse events, for example, housekeeping staff wash floor. The housekeeping would like to clean the floor in the ICU, and they forget to leave the warning sign. So they did not put asides from that unit, that yellow signs to say that wet floor. A patient come and unfortunately the patient slips and fall down because of the wetting floor. This is an example of the incidence because this patient now will be recorded as a falling down. Falling down, here a breach for the international patient safety goals. Another example, for example, dietary staff provided a full diet meal to the patient on clear fluids. Post-op, instead of the information or communication coming to the dietary staff for this patient, that the order was to give him any clear fluids post-operatively. Unfortunately, the dietary staff did not get this information and they bring a normal meal for the patient. And the patient was hungry post-op, then he eat this meal. So the injury happened for the surgical site or whatever. Patient in isolation, for example, maybe the signs that the patient in isolation was not clearly signs. So the housekeeper come and did not take the precaution, and then the housekeeper getting infected from the patient or bring the infection to the patient. For example, also an X-ray technologist failed to read the patient arm banded, and instead of doing the X-ray for the wrong patient, the patient going to the radiology department, and there was improper clarification for the identity of the patient. So these all are adverse events which lead at the end for some events or something happen for the patient. The second type of events we call it near miss, or بالعربي بنحكي الله ستر، يعني كان ممكن أن تحدث مصيبة لكن الله عز وجل سلم وقدر. A near miss refers to a situation or event that can potentially cause harm to a patient but is identified and resolved before reaching the patient. كان من الممكن أن تحدث كارثة لكن الله عز وجل سلم. هذه تسمى near miss. It's often described as a close call or fortunate event that could have resulted in a harm but was prevented due to timely intervention or by chance. ممكن النيرس، ممكن الطبيب، ممكن الهيلث كير بروفايدرز انتبه في آخر لحظة فغير الموضوع، أو أحد ثاني كان مراقب للنيرس أو الطبيب أو الهيلث كير بروفايدرز ونبهه في آخر لحظة، أو حدثت مصادفة منعت هذا الخطأ من الحدوث. Near miss are essential to identify, should be reported and identified, because this can give us a lesson to learn from, because the only way to preventing these hazards from happening is the chance. They provide opportunities to identify potential hazards, system weakness, process error that could lead to the patient harm if not addressed. By analyzing near miss, healthcare organizations can implement proactive measures to prevent similar incidents from happening. بهذا المعنى بنحكي على إنه عندما يحدث عندنا near miss, even if the patient did not getting harm, we should report it. For example, على near miss, the nurse did not do the hand washing before come to the patient. Even if the patient did not get infected, this is still near miss. Or patient risk for falling down and you come to the room and the side raise was not raised. اللي بترفع اللي بنحمي فيها أكتاف السرير بنحمي فيها المريض من falling down was not up, side raise. The patient did not fall down, but this could happen. So in this way, this panoramic overview, since we already started from 6, now we're covering the main topics for the leadership. And now we would like to go for practices. In the practices sessions, we will discuss more what are the kind of questions that come for the leadership questions. Usually how I will deal with the questions related to the leadership in any public exam, like in the license exam, either in Oman or outside, there are some general tips. We should understand what is the answer strategies or what are the way that the questions come. And of course, when we are unable to assure which is the best questions or which is the best option for the answering, let's see these tips and come in deep with it. First of all, the main way to eliminate the problem or able to answer, always getting in facts, eliminate the incorrect answers. There are some options in the question, mainly for the leadership. Rely you or try to mislead you. Any question already contains of two main components: the stem of the questions and the options in the multiple choice example or multiple choice answers. Now, if you are sure about your answer, so go and answer. If you're getting confused, I would like to have a double assurance. Make sure that you are able to eliminate the most incorrect answers or options. If an option contains incorrect facts related to the conflicts, leadership style, organizational power, staffing, quality. So be able here to differentiate that the incorrect facts will not be a suitable answer. Also, there are some tips or distractors coming within the options, and this does not apply to the scenario, as we will see. We'll give you a scenario and give you facts, but not related to the scenario. Or sometimes we will come, or the questions will come to contradict the nursing principles, so this one will be eliminated directly. Also, there are additional tips that will guide us for which is the most suitable answer. We're talking about the leadership questions or management question related. That the absolute words, for example, always, never, all, only. This is give you tips, because in the leadership and management, we're talking about flexibility is the key. So usually when someone would write questions or give you options for the multiple choice answers, they will try here to misguide you that this option mostly will not be the suitable answer. So we will be away from options that have these words. If an options contain an absolute words, it's often incorrect because healthcare situations, mainly for the leadership, require critical thinking and adaptability strategies. Also, always think in identifying priorities related to Maslow hierarchy of needs. Even in the questions related to the leadership, still the patient is focused. So even if the questions will come to ask you about leadership style, conflict, staffing, organizational power, at the end, the patient is the concern. So if the questions involve the decision making, always make the priorities: physiological needs for the patient, airway, breathing, circulation, safety. For the questions related to making the priorities, the nurse will go for which patient first. The charge nurse, what they will do first. Then always make the priorities for the patient based on the Maslow hierarchy of needs, which start by physiological needs. Then after that, the safety, preventing harm, ensuring security, then the psychosocial needs, and make this in your mind when you're going to make the priorities for which task we should start it on. Also, the nursing process is the key. Even this course or this review for the nursing leadership and management, so still the nursing process is the key. Assess before acting. Always, if you are seeing an option that involved assessment before intervention, so for sure it will be the best option. We should do assessment then acting. But in some cases, it can give you an option that acting then assessment. So in this case, you should open or make the red flag that this option will not be the best option to choose. Diagnosis, identify the problem based on a given data. The same way of the nursing process, we are always come in. Plan, implement, evaluate, always come in this way. So always choose an action that align with the nursing process. Even in all options or scenarios, delegation of the tasks, the nursing care delivery methods on the team, that there are a registered nurse, will make a delegation for practical nurses or new junior nurses. So what are the kind of tasks that the junior nurse will receive based on our understanding for this way. Also, for the issues related to the quality or questions related to the quality, usually it's come on this directions that follow the chain of command. What will happen if you notice a problem? If the question asks you about handling an issue, endorsement, conflict resolution, delegation, ethical dilemma, this always follow the appropriate report structure. For the organizational way, we understand that there are head nurse, charge nurse, nurse managers, whatever. So this will be a flow to escalate the problems to the administration and try to find it in proper. Delegation and supervision, remember always to use the 5 rights. What are the tasks, right tasks? Is this appropriate for delegation? When we given a task for junior nurse, new nurse, charge nurse, there are so many questions coming within the requirements for delegation, and also the right circumstances, the condition of the patient, even if this revision for the course called leadership and management. Remember, this is course leadership and management for nurses. So still the patient is the main concern and the center of care. And the delegation questions, are you delivering the patient for the right person? This delegate have the competency to do this task or not? Regarding to the registered nurse, practical nurse, the junior nurse, doctor to nurse, all this should be associated with the right person and the right communication. Clear instruction given. The supervision is still the responsibility of the person who do the delegation, and avoid delegating assessment, education, and stable patients to the practical nurses or a personal helping people. important الأسئلة الخاصة بالديليجيشن عادة بيجي عليها كثير أسئلة مرتبطة بالديسيجن ميكينج اللي هنعمله إحنا as a nurses to provide the care. For the issues related to the leadership style and decision making, there are also a group of confusion happen for the nurses when they answer the questions related to leadership style and decision making. Transformational leaders inspire and motivate. I found that the students getting confused between transformational leadership and democratic leadership. So in the questions, there are some confusion happen for the people. So make sure when you are dealing with a situation or scenario, as we'll come now to see, that you are able to differentiate when this scenario present transformational leadership. Transformational leaders inspire and motivate. Their decisions often focus on the teamwork and shared vision. Transformational focus more to give the information and focus on the other decisions, while democratic still taking input from the team, but at the end, the decision will come much more direct in the democratic. Autocratic leader make a quick, independent decisions. And this is important to know that still it's adapted in the nursing, mainly in the emergencies. The scenarios related to assigned tasks in the CPR or during the crisis of the emergency, then the decision should be direct taking, and the most suitable style will be the autocratic style. Laissez-faire leader, I think we already discussed several examples about the leadership styles. It's less effective in a crisis, but giving so much benefits for the mental health and mental illness. And the reason for that, because it gives the staff space for building their own relation with the patient. The same way that laissez-faire will be more suitable if the nurses show a high level of competencies and ability to deal with the problems. Conflict resolution, always use the least restrictive approach. If conflict arises, choose the least constructive action first. For example, open communication, give you higher priorities or give you an assign that maybe this will be the good option or the best option. Negotiation and comparison, and always mediation before escalation. Try to help and support and solve the problem before making the escalation. This is how the scenarios or the options for the multiple choice questions come regarding to the conflict resolutions. At the end, there are clear scenarios that will give you what to do, and there are some options created in the multiple choice questions aiming to distract you. So when we put all together, then you will still have a doubt between two options, and the two options could be correct, then you will choose the most correct or the most suitable one for this question. Also regarding to the ethical and legal consideration, patient rights, we are advocates for the patient, ethical principles, autonomy, beneficial, non-beneficial principles. For the questions also, this should guide our decisions. If I face dilemma, always choose the option that protect the patient and follows facility policies. In the options, when it comes in this way, so be critically smart to pick up the question. For the time management, the priority of the tasks, which task should be started on, the nurse will make a delegation or start with which task, what are the kind of interventions will taking the highest priority, always the priorities for the patient, and within the care or intervention for the patient, ABCs is the key. Always prioritize the life-threatening issues. The same for the priorities regarding to the stable or unstable. Sometimes the questions come for the stable to say that this patient is stable. And sometimes I will give you a vital signs that based on the understanding of the question writer, the leadership student already understand that the blood pressure, the normal blood pressure is 120, and when the patient getting 90/50, this is hypotension, or getting 170 over 100, that means the patient with hypertension, so unstable. So the stability and instability questions and the priorities need also critical thinking, because they are able to merge the information you get it in the leadership course with the medical, surgical, physical assessment, and so on. The same for the acute and the chronic cases. Acute issues require immediate attention. So when you give you a decision for the nurse to start to care for a patient with a diabetes since 20 years, and now the blood sugar is 120, come to the ED with a cough, and the patient come with a severe cough, but he's young, and then the scenario will lead you that the acute condition need the higher intervention. All the questions regarding to the staffing issues and the work assignments, if the question asks you about handling the staff shortage, so ensure the safety first, and whatever happen, even if we have a staff shortage, understaffing, nursing shortage, nursing workload, whatever, this is not a patient problem. So we should choose the options that lead us to adjust assignments, redistribute the tasks, ask other nurses to come from their own day off, or ask the supervisor to bring help from the other departments. Always make sure that you are not going for an option that avoid personal biases when making staffing decisions. For the quality, there are several types of questions that can guide you or take you to the quality domain. If a question involves an error, sentinel event is a kind of adverse events lead for death. If the death happen or the patient getting permanently lost of organ, we call it sentinel event. Focus on the system. Always the questions that will come on the kind of patient safety will give you an options either to blame the nurse or blame the system. Make sure that you're already on the right track by catching up the system issue. Always the reporting near misses are important. So even if the patient did not getting any injury, still this is a patient safety concern, and the patient's problem or near misses should be documented as already discussed before, the near misses and so on. Okay, so I hope now this is clear. Is there anyone on the stage with a question? في أي سؤال؟ طيب الآن بدنا نبدأ بالأسئلة. We will have a group of revisions or questions related to leadership questions, and we will give you 30 seconds. I hope whom already with us, so please write your guess or suggestions on the chat. نتمنى من الجميع يحاول يشارك اللي عنده سؤال او استفسار. طبعا حنعطي 30 ثانيه نفس فكره تويت ريتويت، وبعديها بنعطي الجواب الصحيح. تمام؟ Are you ready now? جاهزين الآن؟ نبدأ بالسؤال الأول. A nurse manager is using transformational leadership style. Which of the following action demonstrate this leadership style? Time on screen, assessing daily tasks and monitoring compliance, encouraging staff to develop new ideas and monitoring them, following strict policies without staff input, using punitive approach to enforce discipline. مين حاب؟ ما في أحد يعطينا الإجابة؟ اوكي، والجواب الصحيح يكون encourage staff to develop new ideas and monitoring them. So nurse manager is using transformation leadership style following action. So here we directly come to discuss what are the kind of leadership styles or way to apply in this condition. Right, the second question, a charge nurse is delegating tasks to newly licensed nurse. Which of the following tasks is appropriate to delegate? Minimal delegation. So what is the most appropriate kind of delegation tasks to be delegated? طبعا انتبهوا هون على التبس الموجودة في السؤال عندي newly licensed nurse وهي بمعنى junior nurse time on screen. Okay. والجواب obtaining vital signs from a stable post-operative patient. يعني نشوف الخيارات. Administering IV medication. Why administering IV medication is not an option? Because it's a critical ill patient. And the newly licensed nurse, still the problem can happen and the patient can complain. Developing care plan for a newly admitted patient. A newly admitted patient, that means need more experience or cannot leave the patient alone. Performing an initial assessment. Initial assessment is much more critical components. Okay. تحدثنا على الطريقة اللي احنا بنستخدمها عشان نقدر نجاوب السؤال. إذا مر علينا سؤال احنا مش عارفينه، فعادة اللي بكتب الأسئلة كيف بفكر، شو الكومبوننت أو مكونات السؤال، كيف أشكال الأسئلة بتيجي، وكيف الطريقة اللي ممكن احنا نستعمل كونفيرم عليها على السؤال تاعنا أو الإجابة اللي احنا بنعطيها للسؤال إذا كانت هذه الإجابة صحيحة أو خاطئة. فأستطيع من خلالها أني أعمل guessing أو أعمل توقع للإجابة الصحيحة حتى لو ما كان عندي enough information على هذا التوبيك وهذا الموضوع. وبدأنا الآن في التبس تاعت الأسئلة. جينا على السؤال الأول وحلينا هذا السؤال. Nurse manager using transformational leadership style. طبعا من الأشياء الكثيرة اللي ممكن نلاقيها في الأسئلة الخاصة بالليدرشيب هو الترانسفورميشنال. حكينا النقطة اللي ممكن تشكل عائق علينا بالفهم هو الفرق الدقيق اللي موجود ما بين الترانسفورميشنال والديموكراتيك ليدرشيب ستايل. وفي هذا المثال اللي عندنا واضح ان الترانسفورميشنال ليدرشيب ستايل focusing more encouraging staff to develop new ideas and monitoring them. السؤال الثاني كما اتوقع جاوبناه تشارج ناس ديليجيشن او ديليجيتنج تاسكس. عاده هذه التبس تاعتها والاسئله تاعتها احنا بدنا نحط تشارج ناس في موقف صعب انه الان بده يعمل ديليجيشن. ديليجيشن هنا بمعنى تفويض، انه يعطي جزء من المهام اللي عليه for someone else. وبنحط السيناريو عاده انه هذا يكون junior, senior, practical nurse, another charge. كيف بده يصير التعامل عليها؟ الامر كله بده يعتمد على فهمنا احنا لطبيعه هذه التاسكس والاشياء اللي لازم تنعمل معها. فور اكزامبل على هذا المثال اللي امامنا الاي في medication is something critical, so how we will give it to the newly licensed nurse. B, developing care plan for a newly admitted patient. اوكي بس الكير بلان شغله كثير كبيره فنفكر فيها مرتين. obtaining vital signs from a stable post operative patient. اصلا كلمه stable هون ضغط عندنا الارم انه can be the proper option. performing an initial assessment on a client صارت زي developing plan for a newly admitted patient. يعني صارت في عندي overlap ما بين الاوبشن B والاوبشن D وعرفنا انه الجواب بيكون stable condition. طيب خلينا نروح الان نحاول ان الصبايا اللي معنا الشباب الصبايا الموجودين معنا على البلاتفورم انهم يعطونا الاجابه ونبدا بالسؤال اللي بعديه. A nursing unit is experiencing a high turnover rate. Which leadership strategy is most effective in improving retention? Retention هون بمعنى بقاء الستاف في اليونت. تايم سكرين نعطيكم وقت اضافي اكثر حتى يعني نتذكر كيف ممكن نطبق الاستراتيجيز والمهارات for answering this question. هاي نفس السؤال بس عندنا التايمينج again. يلا واللي بيجاوب له حلاوه مر علي على المكتب شوف الحلاوه. يلا خلينا نقرأ الخيارات. increasing the workload of remaining staff to compensate for a lost employee, providing professional development and recognizing staff achievement, discouraging staff from voicing concerns of maintaining stability, implementing strict disciplinary policies to improve compliance. والجواب يكون providing professional development and recognizing for the staff achievement. طيب ليش مش الخيار الاول increasing the workload always is not a proper option لانه اصلا هذا القسم عنده high turnover rate. Now we understand the cycle between the turnover and workload. Discouraging staff from voicing concerns يعني عدم تشجيع الناس بانهم تحكي عن المشاكل اللي هم بيواجهوها. Implementing strict interdisciplinary policies to improve compliance. طب هو اصلا عندي high turnover. انت لما تحط strict disciplinary عملك بتزيد التيرن اوفر فبتزيد المشكله بتاعتها. فبالتالي حتى لو ما كنت انا فاهم ايش المطلوب هون بالنسبه للليدرشيب استراتيجيز ايش الشيء اللي هم بيقصدوه فيها لكن انا قادر اني احدد وين البروبر اوبشن او ذا موست بروبر اوبشن يكون الاجابه. خلينا نشوف هذا السؤال الثاني. time on screen a nurse manager dealing with connect which of the following conflict resolution strategy is most effective. time on screen. تمام. لو طلعنا هون على السؤال بنشوف الخيارات بالشكل التالي. avoiding the conflict to prevent workplace tension, forcing resolution by asserting authority, encouraging open communication and finding mutual solutions, siding with one staff member to quickly end the conflict. إذا طلعنا الآن على الخيارات وبدنا نوازن بين الخيارات which of the following conflict resolution strategies is most effective. إيش أكثر شيء ممكن يكون effective؟ avoiding the conflict to prevent the workplace tension. دائما الافويدنج ما حيودينا بالاخر لنتيجه. طيب forcing resolution ندفع الناس نحو resolution by asserting authority نستخدم الاثوريتي فيها. encouraging open communication and finding mutual solution. هون في عندي open communication وحكينا على الاسئله اللي بتيجي بالconflict resolution. عاده كي component الاوبن communication ممكن يجيب لي الخيار الاوبن communication directly ممكن يجيب examples او طريقه معينه ليطرحها. siding with one staff to quickly end the conflict. siding يعني صف معه او وقف مع واحد منهم. وبالتالي احنا صارت واضح عندي أنا بتحدث عن open communication. Finding mutual solution will be much more beneficial in the conflict resolution. فأنا بروح على open communication and finding mutual solution. مين حلها صح؟ عاد من اللي معنا في الستيج بنشوف الشات إن شاء الله بعدين وبتبين. طيب نشوف السؤال اللي بعديه. time on screen. A hospital is implementing a new electronic health record. system. The nurse leader should prioritize which action to ensure successful change. Time on screen, and please try to answer this question. طيب نشوف الآن الخيارات. نقرأ الخيارات. mandating staff to use system without training. مبين من شكله الخيار الأول إنه فيه مشكلة. mandating إجبار without training. وبعدين عندي implementing بالسؤال ونيرس ليدر should priorities، فكلها عليها علامات استفهام بتخلينا نفكر بالخيار A على إنه ضعيف. providing ongoing education and addressing staff concerns. نقدم التعليم ونشوف وين الكونسيرن اللي كان عند التمريض في هذه السيستم. ignoring resistance and continuing with implementation. ignoring resistance ما بتكون ده الكلمة بتعطي impact سيء. assigning only senior nurses to use the system ما بطل منه الهدف، معناته صرت انت عامل discrimination بين الستاف على السينيورتي، وبعدين راح ندخل هون في مشكله مين السينيور ومين الجونيور. طلعنا الان على الاجابه، فبيكون عندي providing ongoing education and addressing staff concern اكثر نقطه اعطت sense of logic in providing the care or in the priority leadership priority to successful change للإلكترونيك هيلث ريكورد سيستم. أتمنى إنه اللي معنا الآن على البلاتفورم they already catch these differences. خلينا نشوف المثال الثاني. السؤال الثاني اللي عندي time on screen. A nurse manager noticed that patient care error have increased due to high workload. What should be manager's priority intervention time on screen? تمام. الآن نقرأ الخيارات عشان نشوف أنتم كمان كيف أنا ممكن أفكر في هذا الخيار. خلينا نحكي إنه أنا مش عارف بالضبط السؤال لوين بده يوديني، بس أنا فهمت من السؤال. عندي نيرس مانجر، في عندي patient care errors معناته رد فلاج increase to high workload، هذا الفلاج الثالث. What should manager priority intervention. priority intervention معناته ممكن يكون في عندي أكثر من جواب صحيح، لكن أيهم الأصح. encouraging nurses to work overtime to complete the tasks. طب ما هو اصلا عندي workload عالي. workload عالي يعني ان النيرسز عندهم مشكله بالورك ادت الى وجود الاخطاء الطبيه، فازيد عليهم الورك لود وازيد عليهم التايم اوفر تايم، فصفت هذه مشكوك في امره. assessing staff level and advocating for more staff. خلينا نحسب الستافنج ليفل، كم عندنا عدد التمريض الموجود، هل نحن بحاجة ستاف إضافيين ولا لا، مع زيادة ورك لود والبيشنت كير ولا لا. أوكي خلينا نحطه، ممكن يكون خلينا نشوف الخيارات الثانية. implementing a zero tolerance policy for errors، يعني أن لا نقبل أي خطأ. بالعموم أنا ما بدي أي خطأ أصلا يصير مع أي مريض، لكن zero tolerance policy يعني تعطي إشارة أو دلالة على وجود عقوبة ممكن تطبق على التمريض اللي هم أصلا صار عندهم patient errors due to high workload. يعني مش كتير مشجع الخير. holding individual nurses accountable for mistakes. هم individual nurses accountable for their own mistakes، بس هذا شو اللي حل المشكلة؟ وين حل المشكلة؟ صار في الخيار دي، فبالتالي بيكون الجواب assessing staffing level and advocating for more staff. تمام؟ طيب نشوف السؤال اللي بعديه. Which of the following leadership behavior best promote culture of safety time on screen? طيب مجرد ما سالنا هون على الكلتشر اوف سيفتي، عن اي سيفتي بنحكيه، من فوكس تاعنا بيكون على البيشنت سيفتي وعلى الاشياء التي ستضمن وجود الامان في داخل القسم او المكان اللي احنا بنعمل فيه. خلينا نقرا الخيارات. punishing staff for reporting errors. أعاقب الناس على كتابة أنهم حددوا وجود الأخطاء. وأكيد هذا شيء أنا ما بدي إياه، صح؟ يعني هذا شيء خاطئ، هذا لا يؤدي إلى الكالتشر اوف سيفتي، لأنه في هذه الحالة الناس will not try to report errors. فأنا كمانجر in this way I'm thinking in a negative consequence, so I will not go for this option. Encouraging teamwork and non-punitive error reporting. انه انا اروح اشجع التيم وورك وبنفس الوقت اعمل non-punitive او non-punishment related error reporting. اوكي طيب نحطه على جنب نفكر فيه. keeping safety concerns confidential. نحاول دائما هون انه نحكي على safety concerns، الاشياء التي ممكن تؤثر على المريض بشكل confidential، ما نحكي عنها، نخبيها، ما نخبر عنها، تمام، ما الناس تعرفها. دي assessing blame to individuals instead of evaluating the system. دائما اول خيار، لانه بدي اعكس السؤال واحكي والله اي خيار لازم استبعده في الاول، انه انا احكي blaming to others او blaming individuals. احنا ما بدنا في الليدرشيب، كل الايديا تاعت الاسئله هذه انه احنا we are looking to improve the system not blaming individual. بناء عليها مين جاوب، مين اعطى جواب على السؤال هذا؟ بيكون encouraging teamwork and non-punitive errors reporting. إذا اطلعنا على هذا السؤال احنا بنلاقي إنه في عندي مجموعة من الخيارات ممكن تكون confusing، صح؟ بس طريقة فهمنا وتحليلنا للخيارات حيؤدينا إلى معرفة أي الأسئلة كان الأفضل فيه. طيب شوف السؤال اللي بعديه. هلا بنعد لكم التايم. A nurse leader is advocating for a new policy to reduce nurse burnout. What is the most effective advocacy strategy in time on screen? حاول اللي موجود معنا على البلاتفورم، اللي موجود معنا على التيمز، بس يحط اجابته، اي اجابه على الشات بوكس، يشوف شو الإجابة اللي هو حاسس إنها ممكن تكون الأقرب إلى الدقة. طيب نقرأ الآن الخيارات. Presenting evidence-based research on burnout impact. Ignoring staff complaints and focus on a patient care. Implementing the policy without consulting administration. Ask staff to manage stress individually. احنا بنحكي عن البيرن اوت اللي ظاهرة الانحراق الوظيفي. What is the most effective advocacy strategy? كيف ممكن يكون الليدرشيب بهذا الاكزامبلز يقدم أكثر ليدرشيب أو advocacy strategy. Evidence-based practice on research on the burnout impact. نعمل application ونشوف ال evidence-based practice part من الكواليتي. Ignoring staff complaints and focusing on patient care. دائما فكرة ال ignoring أو ال blaming مش هي اللي احنا بنبحث عنها. احنا leadership we're looking to not ignore and not blame people individually. Implementing the policy without consulting administration. اروح اعمل policy واطبقها بدون ما اروح للادمنستريشن، يعني الاداره هون او الاداره العليا. طبعا implementing the policy it's fine، بس اجت الكلمه اللي بعديها without consulting the administration طرحت علامه استفهام، خلت هذا الخيار في مستوى عالي من الضعف. asking staff to manage stress individually صفت انه احنا عمالنا بنحكي على blaming the people for having this stress and this is not what we are looking for. فبالتالي بيكون الجواب الصحيح presenting evidence-based research on burnout impact، اللي احنا بيخلينا نطلع من ال evidence-based practice او ال evidence-based research utilization لتطبيق آلية نقلل فيها البيرن اوت. هذا مثال ثاني على مجموعة من الأسئلة ممكن يكون فيها trying to confusing you بأكثر من طريقة أو confusing the student أو اللي داخل على الامتحان بأكثر من طريقة، وهيك احنا حللنا الطريقة اللي نتعامل مع هذا السؤال. خلينا نشوف مثال ثاني. Time on screen. Nurse leaders work to improve team collaboration. Which of the following strategies is most effective? Okay, time finish. So الإجابات. Okay. اللي عندكم اللي حاط الإجابات على الشات. بطلع معكم الشات، في ناس طالع عندهم شفتوا ناس لا. طالع عندهم الإجابات. أوكي، عايشة، لميس، جواهر، شكرا يعني على التفاعل. طيب كمل. شوف رأيكم الآن. نيجي نقرأ الأسئلة، نقرأ الخيارات. Assigning strict rules and discouraging teamwork, encouraging interdisciplinary meeting and shared decision making, avoid team discussion to prevent disagreements, relying on hierarchical decision making without staffing inside. هذه مقطع عليها بالعداد تاع الساعة. طيب نرجع عليهم هون نحكي team collaboration. احنا اللي منكم حضر واللي باخذ معنا ان شاء الله team formation step اللي حاليا مسجلين في الإدارة will coming within the coming 2 weeks. حنعرف انه الكاركترستيك تاعت التيم لها بارت من الاستراتيجيز اللي لازم يعملها الليدر. نشوف assigning strict rules and discouraging teamwork، يعني مبين انه هذا مش هذا اللي احنا عمالنا نسال عنه، لانه عمال بيحكي على most effective. طيب encouraging interdisciplinary meetings and shared vision. okay, avoid team discussion to prevent disagreements. يعني avoid معناته ما صار في عندي تيم، فمعناته مش هذا اللي انا بدي اياه. relying on hierarchical decision making معناته احنا برضه صرنا في الاوتوكراتيك ليدرشيب ستايل وما رحنا على التيم وورك. واتوقع ان هذا السؤال سؤال دايركت وسهل وواضح بنحكي على encouraging interdisciplinary meetings. طيب شوف السؤال اللي بعديه. nurse leader is monitoring a newly promoted charge nurse. which leadership advice is most appropriate? هذا النوع من الأسئلة هو من الأسئلة اللي كثير متكررة في مواضيع الليدرشيب والمانجمنت، اللي مبني على فهم مركب. أنا بسميه فهم تخيلي مركب. إيش يعني؟ إنه بدنا نتخيل a good leader would like to give a good advice for good students. يعني أنا في عندي أكثر من مستوى أو طبقة من طبقات التخيل. أنا اللي بحكي على nurse leader عمال بيعمل advice or monitoring لنيولي promoted charge nurse. يعني leader عمال good leader بده يعمل بروموشن لجود تشارج نيرس، يعني another good leader بده يحكي له كلمة على شكل نصيحة تعني انه we are in the optimum options. انه عمالنا نحكي على good leader talking to the good staff. make decisions independently without staff input. احنا عارفين انه هذه الكلمة ممكن تكون صحيحة في الاوتوكراتيك ستايل، صح؟ ممكن تكون صحيحة في الامرجنسي سيتويشن، بس هل تعني هي في اي كلو انه هذا الليدر بيحكي على emergency سيتويشن او هذا التشارج نيرس بيحكي على emergency سيتويشن؟ خلينا نحطها على جنب. الخيار الثاني بيحكي على use a mix of leadership style depending on the situation. هذه الكلمة بتنفع مع الامرجنسي سيتويشن، بتنفع مع المنتل هيلث، بتنفع مع السيرجيكال وورد، بتنفع بس يعني عامة، بس برضه شغالة يعني بتنفع. طيب شوف سي always follow orders from upper management without question. في هذا السؤال في هذه الحالة هذا الاوبشن صار بنفع اذا كان النيرس ليدر اللي بيعمل الادفايس هو اوتوكراتيك ستايل، فهو بده يضمن انه اللي تحتيه يضل تابع ويسمع الاوامر تاعته. ما عندي دلالة على أي شيء بهذا الاتجاه. D rely only on experience rather than evidence-based practice. إذا كان الخيار إنه أنا بدي أختار أي هذه الخيارات هو الأضعف والأبعد عن الدقة فحيكون D. الأصل إنه أول شيء أستبعده D. ليه؟ لأنه أصلاً الأدفايس كيف بدها تنعطى على rely on experience rather than evidence-based practice لواحد أصلاً newly promoted charge وما عنده experience. فصفت إنه أنا بعطي لا شيء لواحد ما عنده شيء، أو بنفي وجود الشيء عن واحد ما عنده اصلا شيء، فصفى الخيار دي انتهى. اذا انا الان قدرت اني اوازن بين التنتين واتخذ كل واحده فيهم. صار في عندي الخيار الاول انا يا ابني بدي اياك اوتوكراتيك، الثاني غير ليدرشيب ستايل على حسب المواقف، الثالث انا اوتوكراتيك. فصفى اكثر واحد اقرب للدقه حيكون الخيار بي use a mix of leadership style depending on the situation. نشوف الخيار اللي بعديه. nurse manager believe in making the final decisions but seeks input from staff. which leadership is this? اتوقع ان هذا السؤال سؤال دايركت ما لازم نطول عليه كثير. مين النيرس مانجر؟ making final decision seeking input from staff. مين اللي عماله ياخذ الفاينل ديسيجن but seeking input from staff. اتوقعنا هذه انه من دائما احنا بنحط عليها التريك. الان في هذا السؤال مين اللي عماله بياخذ input from the staff؟ اكيد مش الاوتوكراتيك، صح؟ واكيد مش الليزسفير. عاده هذه الاسئله اللي بتيجي بهذا الشكل بيكون هدفها انه يعمل كونفيوجن للي بده يجاوب ما بين الديموكراتيك والترانسفورميشنال، لانهم الاثنين بتعاملوا مع انبوت من الستاف. بس الكريتيكال كومبوننت الاساسي انه في النهايه الديموكراتيك ستايل حيعطي فاينل ديسيجن بناء على الانبوت اللي حياخذها من الاخرين، بينما الترانسفورميشنال راح يضل يدفع الناس نحو الاتفاق على خيار. فبالتالي الديموكراتيك لا يشترط فيه انه الكل وافق على الكلام، لكن المعظم وافق على القرار او اخذنا براي الاغلبيه. الترانسفورميشنال بيحاول دائما انه يدفع نحو توافق وبيكون القرار بايد المجموعه. تمام؟ فهذه نقطه كثير مهمه. شوف السؤال اللي بعديه. Two nurses are in conflict over patient assignments. The charge nurse tells you need to work this out among yourself. What conflict resolution is this? في عندي conflict، هذا الليدر حل المشكلة بهذه الطريقة، بهذه الطريقة، هذا أي strategy for conflict resolution أخذها التشارج نيرس. نرجع نحلل السؤال نفسه. احنا في conflict والنيرس والتشارج نيرس حل الكونفليكت هذا. حله كيف؟ استخدم عباره او وصل بكونكلوجن انه you need to work this out among yourselves. كل واحد يشتغلها لحاله بمعنى الكلام. بهذا الشكل what conflict resolution is there avoidance happen, accommodation, compromising or collaboration. واضح من طبيعه الرد انه هذه مش collaboration لانه out among yourselves. صح؟ you need to work this out among yourself. فبالتالي بيكون الجواب اللي عندي هو avoidance. ليش صار avoidance؟ لأن في هذه الطريقة بهذه الكونديشن اللي أمامنا في هذا السؤال صار في عندي ignorance للكونفليكت. كل واحد يشتغل لحاله، كل واحد يروح لحاله، ما يكونش دخل في بعض. بمعنى الكلام هذا اللي بيصير معي انا دائما انه الافويدنس ignoring the conflict and this is the worst scenario. طبعا هذه طبيعه الاسئله اللي بتيجي عليها كثير متعدده ومتشعبه، في اكثر من شكل ممكن يجي عليها السؤال. اما بيجي بالشكل المباشر اللي امامنا انه two nurses in conflict، وممكن يجيب لك اياها على شكل سيناريو على conflict happen between patient or nurse or nurse to nurse or patient to patient or nurse to doctor doctor و allied health. في اكثر من طريقه ثالثه. دائما تذكر ال conflict resolution avoidance ال accommodation ال yielding ال compromising وال collaboration. اتوقع انها موجوده اذا جيتوا دخلتوا متاخرين، فاحنا شرحناها في التفصيل في بدايه هذا اللقاء، واللي موجودين معنا في الكورس بيكونوا كمان اخذوها في ماده الليدرشيب. شوف السؤال اللي بعديه. A nurse witnessed a coworker administering the wrong medication and failing to report the error. What is the first action the nurse should take? Time on screen. طيب نحلل السؤال. Confront the nurse and demand an explanation. تخيلوا الآن الموقف، وهذه بسموها الايماجينري كمان بارت من الايماجينري سيتويشنز أو الأسئلة اللي مبنية على تخيلك أنت للواقع كيف صارت. نيرس ويتنس أنا كووركر administering the wrong medication. أنت أو ممرضة أو نيرس شاف كووركر نيرس ثاني administering the wrong medication and failing to report the error وما عمل أي ريبورتنج للخطأ. What is the first action؟ لما نحكي على فكرة هذا الفيرست أكشن معناته على الأغلب كل اللي تحت صح، بس إحنا عمالنا بنسأل عن الأصح، وهذه نقطة كثير مهمة وكريتيكال. تحتاج انك تعمل بارجيننج عليها او ديسكشن. confront the nurse and demand an explanation. وقف قدام الناس قول لهم اعطيني ايش اللي صار، ما الذي تفعله، او لماذا فعلت ذلك، او ليه سويت الرونج ميديكيشن، او ليه ما كتبت الريبورت. هذه المقصود فيها ب demand an explanation. خيار B report the incident report to the charge nurse.
وفي التنتين صحيحات. احنا ما بنحكي انه هذه التاسك لازم تنعمل وهذه التاسك لازم تنعمل. فايل ان انسيدنت ريبورت immediately، اكتب الانسيدنت ريبورت لانه هو ما كتب الانسيدنت ريبورت، وهذه كمان كونسيستنت تو فاين لانه بعد تكتب الريبورت حتعطينا التشارج نيرس، فاحنا بدنا بنحكي على اوبشن could be done. notify the patient's physician او نخبر الطبيب المسؤول عن المريض عشان نتاكد على الفيزيكال كونديشن تاعته. في هذه الحاله احنا ما بنحكي على كل الخيارات صحيحه، لكن أيهما الأكثر صحة ودقة؟ أيهما التي يجب أن نفكر فيها أولا؟ الآن الخيارات ممكن نغيرها. الآن في الترندز الجديد في النيكليكس عشان يشيلوا كلمة فيزيشن بيستخدموا الفيزيكال اسسمنت أو شيء بهذا القبيل، لكن دائما إحنا بنفكر على إنه إحنا بدنا نتأكد البيشنت's condition coming in a proper way. ريبورت إنه يا تشارج نيرس تعال الحق شوف شو اللي صار، فكر فيها بهذا الشكل. ذكر دائما انه هذه الاكزامبلز اللي حكينا فيها كانت تحكي بس على الام سي كيوز. ممكن الان تجيك الاسئله بشكل غير الام سي كيوز، غير المالتيبل تشويس انسرز. ممكن يجينا ستايلات جديده من الاسئله، منها الشورت انسر. الامثله او ترندز الجديده اللي صار بالشورت انسر من اللي في الاسئله الخاصه بالليدرشيب ممكن يجيها على ديفرنت ميثودولوجي. برضه بنفكر بنفس الطريقه، ولازم يكون عندي بروبر اندرستاندينج للسيتويشن اللي انا موجود فيه. خلينا نشوف هذا السؤال. وما هي انسب كلمه توضع في هذا الفراغ؟ Nurse managers follow the leadership style where decisions are made with the staff input, but the final decision rests with the leader. This is known as the فراغ leadership style. معناته في هذا السؤال، حل السؤال نفكر فيه، بسأل عن specific leadership style، صح؟ بناء على الموقف التالي: leadership style where decisions are made with the staff input but the final decision rests with the leader. حطيت التو كونديشن، وهذول التو كونديشن صاروا خيارات. أي ستايل فيهم؟ شو رأيكم؟ أي ستايل اللي فاضي بيعرف يكتب كذا حتكون الديمقراطيك. اوكي؟ مش ترانسفورميشنال. اكيد احنا لغينا الاوتوقراطيك ولغينا الازسفير، بس حتختار او تحتار ما بينهم. الانذر ميثودولوجي اللي ممكن تجينا في اسئله الليدرشيب اللي هي سيلكت اول ذات ابلاي، وهلا صارت في ترندز جديد حتى في امتحانات النيكليكس على سيلكت اول ابلاي. خلينا نشوف هذا السؤال. nurses delegating tasks to an LPN يعني licensed practical nurse or practical nurse. Which of the following tasks are appropriate for LPN? Select that all that apply. معناته عندي أكثر من إجابة صحيحة ولازم أختار أو أشوف ممكن يكون في عندي أكثر من إجابة صحيحة. خلينا نطرح السؤال مرة ثانية. تيم وورك في النيرسينج كير ديليفري ميثودز، حكينا على التيم نيرسينج. النيرس ريجسترد نيرس شغاله مع براكتيكال نيرس. ايش هي طبيعه المهام التي ممكن ان تفوض او يفوض فيها النيرس لبراكتيكال نيرس؟ Administering oral medication, assessing patient lung sounds, performing dressing change يعني wound dressing مقصود فيها، teaching patient about insulin self-injection, monitoring stable post-operative patient. إذا أول واحدة لازم نعرفها ونشوف أني اللي ممكن تزبط معنا. حيكون عندي بدل stable post-operative معناته يعني able to detect stability condition ويخبرني إياها يسجلها على السيستم، معناته ممكن نحط E. لكن لما نرجع هون احنا بدنا نفكر فيهم مره ثانيه بانه select all that apply، معناته يمكن يكون في عندي خيار ثاني كمان صحيح. الآن لو طلعنا احنا على الخيار اللي قبله دي teaching a patient about insulin self injection، نعرف انه الانسولين شوي كريتيكالي تاعته عالي، وعمالنا نحكي احنا على ال LPN critical issues teaching the patient، دائما teaching the patient responsibility of the registered nurse، لانه اذا البيشنت ما فهم او عنده اي اسئله بده يكون في عندي حدا قادر يجاوب على كل الاجابات تاعته. لذلك دي لن تكون خيارا صحيحا فبستثنيها. performing a dressing change، في هذه الحالة عماله بيطرح على شغلة تبدو على انه في عندي كونتاكت مع البيشنتس بالووندز، او الدريسنج كمان بتيجي بمعنى ثياب او تغيير الكلوذينج تاع البيشنت، ما فيها الكريتيكاليتي بتاعتها عالية. لكن لو شفنا على البي assessing patient lung sounds، هاي بدها experience، بدها training، بدها واحد زي حضراتكم راح ياخذ الفيزيكال اسسمنت كورس، تدرب على اللنج ساوندز، تدرب. اذا الاسسمنت ما حتكون proper condition او proper task اني انا اعملها delegation. الادمنسترينج اورال ميديكيشن، بما ان الاوردر واضح، الاورال ميديكيشن الكريتيكال ليفل تاعتها اقل من الانجكشن، فممكن نعملها delegation. يعني ممكن يكون في عندي الاوبشن A كمان ناخذ بعين الاعتبار، وبالتالي الجواب الصحيح في هذا السؤال بده يكون انه احنا اخذنا A C و E. بكل الاحوال assessing patient lung sounds بدها experience اعلى education اعلى، فراح نعملها delegation. teaching patient about insulin self injection، حكينا الانسولين it's a very high alert medication، وما راح يكون option انه نعمل له sending نعطيه للبراكتيكال نيرس. A new nurse witness a co-worker، طبعا واحدة أو نظام ثاني من الأسئلة أن a new nurse witness a worker administering medication to the wrong patient place the following action in the correct order. اللي أخذوا الليدرشيب الفصول الماضية بيعرفوا الأسئلة اللي بتيجي زي هيك في الكواليتي. بهذه الأسئلة احنا في الكواليتي ايشوز عمالنا بنطلع على مش بس the most priority، وإنما following وترتيب هذه الأحداث. Place the following actions in the correct order. ايش يعني؟ يعني اي المهام راح تيجي بالاول، بعديها اي مهام الثانيه، بعدين اي مهام الثالثه، بعدين اي مهام بالرابعه. عندي 4 مهام بدي ارتبهم من الاول عملا للاخيره من ناحيه الترتيب تاعتهم. ايش هم المهام؟ فايل ان انسيدنت ريبورت، لازم نعمل، بس متى لازم نعمل او وش ترتيبه في الاوردر تاع الاكشن. assist the patient for adverse events، صح لازم نعمل اسسمنت للبيشنت. notify the charge nurse، معنا لازم نعمل notify و document the medication error. بس مين اول وحده لازم نفكر فيها ونروح فيها؟ تماما بنفس الاستراتيجيه leadership management اي كورس، اهم شيء ايش حيكون؟ assess the patient for adverse events. بعديها بتروح انت بتمشي بالاجراءات والبوليسيز بتاعتها، فيكون الترتيب عندي 2 3 1 4. 2 يعني اهم شيء انه انا عملت السنجل بيشنت، للتشارج نيرس عبيت الانسيدنت ريبورتس ومشيت في الادمنستراتيف بارتس بتاعتها. اوكي، الاسئله هذه كمان بتيجي كونفيوزنج، مهم جدا انك انت تعرف البريورتيز بتاعتها بالترتيب المذكور. من الاسئله كمان التايبس اللي ممكن تلاقيها في النيرسينج اكزامز true or false. nurse manager using laissez-faire leadership style providing minimum supervision and allow staff to make independent decisions. هذه true or false. نحكي على specific characteristic في leadership style. اتوقع ان هذا السؤال كمان دايركت، اسئله true and false بتكون confused لانه فيش عندي غير خيارين، يا true يا false. فيعني رب رمية من غير رامي، ممكن احتمال 50% ما تزبط معك. بتطلب منا انه ننتبه على كل كلمة موجودة بالسؤال اللي امامنا. laissez-faire provides minimum supervisions and allows staff to make independent decisions. وعاد مبينها بارت من الكاركترستيك تاعت laissez-faire اللي عادة بيكون السؤال معمول بطريقة عشان يعمل لك confusion، لكن it's directly رايح يسألك على leadership style بكل هذه الأريحية بتاعته. بركز دائما على الكونكشن اللي ممكن يصير بين الأسئلة تاعت الليدرشيب، انه احنا ما بنقدر نحكي زي ما بنعمل في الجامعه والله ماده الميد ما لهاش دخل في ماده الفاينل، لا احنا ممكن نجمع ماده المنتال هيلث، السايكاتريك، البيدياتريك، ماده اول محاضره مع ماده اخر محاضره. طلع المثال اللي امامنا هنا يونت اكسبيرينسينج فريكوينت ميديكيشن ايرورز. هذه الستيتمنت اللي نبدا فيها احنا بنحكي على الكواليتي بارت اللي هي من اواخر الاشياء اللي موجوده في ماده الليدرشيب. and staff report poor communication during the shift changes. وهذه لها دخل في الكوميونيكيشن والconflict resolution، معناته صارت في المدى الوسط. طيب, as the nurse manager, which leadership approach should be most effective in resolving these issues? Leadership style أو leadership approaches هي واحدة من أوائل المحاضرات في مادة leadership. إذا في نفس السؤال قدرنا إنه نعمل connection ما بين كل مواضيع الإدارة في نفس الكورس، وأنا أعطينا على leadership approach. طيب نرجع نحل السؤال. Experiencing frequent medication error مشكلة. Staff report poor communication, conflicts ومشاكل. I leadership style will be the most appropriate autocratic, laissez-faire, democratic وtransactional. مش عارف ليش الساعة ما اشتغلت على هذا السؤال، لكن تقدر تحط الجواب على الشات. صارت واضح عندي هون إنه الديمقراطيك is the most suitable leadership style كان approach في هذا الموضوع.